Hello there. We are still discussing transfusion-transmissible infections, and the conversation has been interesting so far with a lot of knowledge shared. So, continuing from where we stopped, Sarah, I would like to ask you, how do you ensure proper storage of blood? How do you store the blood that has been donated safely?
Okay. Blood, whole blood is usually stored. So there are different blood components, right? So whole blood usually stored by between 2 to 6 degrees Celsius in the fridge. So that's like fridge temperature, right? So that's why you store whole blood. And then other blood products. So we have the platelet concentrates. So platelet concentrate usually stored. So the platelet concentrate is stored at room temperature. So between 22 to 25 degrees Celsius. So, but with constant agitation because it's platelet, so that it doesn't clot and then everything becomes useless. So you also have what's called fresh frozen plasma. So fresh frozen plasma is stored at minus 40 degrees Celsius. So that can actually last for up to a year because it's stored frozen. So as long as you don't bring it out to defrost, it is safe and everything is intact. So yeah, so the lifespan for the storage of red whole blood, which is 2 to 6 degrees, is actually 35 days. Okay.
I wanted to.
You wanted to ask that?
Yes, I wanted to push it to her, but you've started, so
she can continue.
Just continue.
Yes.
Please tell us how, as in the lifespan of this blood that is donated or their components. How long do they?
For red cells or blood, anything cells, it depends on the anticoagulants. Yes. So the most common anticoagulants and what we primarily use in places like Nigeria is an anticoagulant called ACD, and the lifespan for that blood in that anticoagulant is 35 days. But when another component is added, that is ACD, that's the adenine component, makes the blood last for a longer period and it can last for 42 days.
So taking me back to blood transfusion.
Yeah. So outside this country, in Europe, in America, the blood they have lasts for longer periods because they use that particular type of anticoagulant. So that because you have a lot of people that transit between Nigeria, Africa, and so it's good that we know those two. But in Lagos State, in Nigeria, it's usually about 35 days. So for fresh frozen plasma, she has said it, 1 year. For platelet concentrates, about 5 to 7 days. So it lasts for a very short period. And
that's the one you have to agitate.
That's the one you have to agitate at room temperature. Those are the questions. You mentioned something else.
No, just the length of time.
Just the length of time, yes. Okay. And then we have the cryoprecipitate, just like fresh frozen plasma.
Yes.
It's a component you get from the fresh frozen plasma. It also lasts for about 1 year. But if you thaw it, I shouldn't go too deep. No, I think we're okay. We're okay.
It's always interesting. Okay, Dr. Anne, I'd like to ask on the distribution of blood. So how does the bank distribute blood?
Okay, so we are a hospital base.
Okay.
So we are not doing distribution per se.
Okay.
We meet the needs of a hospital.
Okay.
So a request is sent to the blood bank based on the attending clinician who thinks the patient needs blood. So we can have emergency requests, we can have routine requests. Routine is that they are going for a planned surgery and they envisage that surgery might need about 4 units, 2 units. So those are routine. Emergency, which is really the ones that we have to be on our toes for, coming at any time. The patient is bleeding. And just as you've been hearing, I'm sure people will wonder, why do we say platelets? Why do we say... I should tell you that if you donate 1 pint, you might be saving 3 lives.
3 lives.
So you shouldn't forget that. 1 pint saves 3 lives.
Lives. Yes.
So we take out different components and we give as required. So some people might just need the fresh frozen plasma. Some might just need the platelets because the only thing they have at that time is that the platelet is low. And so we give. So distribution depends on the need of a patient in the hospital. I think Lagos State does more distribution.
Yes, I'll come to you, but do you relate well with what she's saying, being in a facility that also serves the hospital?
Exactly, yes.
Okay, so based on
basically the same thing, yes.
Okay.
So we don't distribute as
Though
well.
we give platelets, we give red cells to people out of the hospital. But for us, a request must come before we can issue.
Okay. Yes. So Dr. Shikamaya.
Yes, so BTS, that's the Lagos Blood Transfusion Service. We both distribute and we also offer we meet the needs of the hospital. And there's something that we do in Lutz, because I've been in Lutz before. Once you want to collect, after the request has been made, the blood must be collected in a blood transport box and should have a cold, an ice pack if it is red cells or whole blood.
So that in cold chain.
In cold chain, so that until you get to where it needs to be transfused. And if it is the platelets, it is kept we usually use a foil or we use a container so that it's kept agitated until it gets to where it to be transfused. Now, if you need to take blood out of the facility, we need to depend on what's the hospital that needs it, maybe the hospital or the blood bank. So sometimes they have utility vehicles. Utility vehicles might be normal vehicles or it might be their ambulances. They can come to receive the blood from us. But it also depends on the requests. So you must request before we can give. So you might request for, because most of the people that request have existing blood banks. So they might have had a blood, we are requesting for this particular blood group, or you send the sample of your request to us to group and give you the blood based on the request. And then if the blood bank is unable to come with their utility vehicles, the Lagos Blood Transfusion Service has 3 registered third-party logistic bodies. So these are like bikes, they're bikes, and all they do is to transport blood and blood products. So we have 3. She's very familiar with Qatar because Qatar is registered with SYNLAB and MCCHO. So they work with different. We have Life Bank and we have IMA Health. So all they do is to move blood around. So once the request is made, it might be made to them or directly to us. They come, the blood is packed in specialized WHO transport boxes that has been validated in Nigeria. So some of these boxes work very well outside the country, but once they come into this environment, because we have a different environment and ambient temperature, we might not be able to use. So we need to revalidate them in Nigeria with our own equipment, with our own units of blood, to know how many units of blood such transport boxes can carry at each particular point in time. So once you are going out, is either with the utility vehicles from the requesting facility or with those third-party logistic bodies.
Okay, thank you very much. Dr. Anne, please, I would like to ask you, any new technology that you believe can, or you've come across, that you believe can help us to improve blood storage?
Oh, she said if it's storage, she had actually mentioned it. If you were talking of screening, there are other things, and safety generally, but in storage, there are
new technologies.
They are new to us here, but not new globally. You know, because globally, we can even freeze red cells for patients with red blood group. We don't do that here. So there are a lot more that is being done globally that we are not doing. But in terms of blood safety, there are new things. There are pathogen reduction technologies, which further reduces the risk of transmitting infection, even if by chance you have missed it during your test. That we also, so there are technologies like that. There's a nucleic acid testing, which further helps us to test and make sure the blood is safe. So there are technologies that are indeed evolving or has evolved, but has not catch up. We're yet to catch up.
Okay. I know we've been hearing about the infections that can be transmitted just sparingly, but I would like you to really help us outline those infections that can be transmitted through blood transfusion, like the recipient is at risk, including those that are in their latent period and all that.
So I would like to say initially that potentially any blood disease infection that is carried in the blood can be transmitted. That should be, and therefore we also, because of that, we know that there are those we haven't seen, which we call emerging transfusion-transmitted infection. But because of our time, 4 most common ones are the HIV, the hepatitis B, the hepatitis C, and syphilis infection, which WHO mandates that we must all screen for. Having said that, there are some that are more domiciled in some areas that are not. Like viruses are so many. Yellow fever, what do you call it? There are so many viruses that are being transmitted. Hepatitis A, hepatitis E. We're even seeing that in our own environment as well, because one of the studies we did somewhere in the Southwest, we saw about 4.3% of the donors were positive for hepatitis E. So we have the viruses. We also have the parasites. Commonly here people think about malaria, but we're doing a study which we've finished but not published, really looking at, is it really possible when we have stored the blood to transmit malaria to the donor? What we're seeing now, because we actually did genotyping of, is that the risk is negligible, So when that is out, you will know. But those are things that parasites, bacterial infection, usually the bacterial infection are from the skin of the donor, maybe while. So there's a wide, in the West, they talk of prions, which are proteins that cause some neurodegenerative disease in the brain. Yes, so there are a range: bacterial, virus, parasites, prions. But the four most common one, which we screen for standard, are HIV, hepatitis B, hepatitis C, and syphilis.
Okay, so there you have it. The four most deadly
important
infections that can be received from donation. HIV, hepatitis B, hepatitis C.
And syphilis.
And syphilis. Thank you very much. So we'll be right back. Thank you.